Hi, my name is John Shinn, and I'm the Senior Product Specialist here at Empower Brokerage. Have great questions today. Get all kinds of questions during the week from both consumers and agents. So I had a really good question that I want to go over with you today. It has to do with the mistakes that people make when buying Medicare plans, Medicare supplement plans, choosing those plans. And there are mistakes that people make. One of the things that we see here are mistakes that are made pretty much in every area, either with original Medicare, adding a Medicare supplement, or adding Medicare Plan C's, Part C's, or drug plans. So I wanted to go over a few of these. We have a pamphlet that we offer to both agents and to consumers that work with Empower Brokerage, and this little pamphlet has 10 mistakes that are fairly common. Actually, we can see really 15 to 25 different types of mistakes, but to keep this brief, there are 10 basic ones here that everyone should really know about. One mistake is assuming you don't qualify. So we see that a lot, where the person who's applying for Medicare thinks they may not qualify because they haven't worked enough quarters. One really good example of that is a spouse who never worked, and the spouse that works at home. Just break right there. So one big common mistake that we see is that assuming that you don't qualify for Medicare coverage because you don't have enough quarters. A good example of this would be a spouse that stays at home, and the working spouse is at work all day and they get enough quarters. But because your spouse worked and qualifies for Medicare, the at-home spouse qualifies too. So that's a mistake that we see that folks made, or there's some lack of clarity there. Another is failing to enroll in Part B on time. I think everyone knows that you must enroll in Part B when you're first eligible to do so, or you will incur penalties for not enrolling. And one of the big reasons that people don't do that is because they just don't want to pay the Part B premium. And there are consequences attached to that. So you'll want to enroll in Part B when you can. Number 3, another mistake that we have, and I'm reading this. Yes.
I need you to show it off more.
Show this more?
Yeah.
Yeah, okay. So the third big mistake that we see, and I'm reading here from our pamphlet, and you can get this just by calling and asking the 10 biggest mistakes that people make with Medicare. Believing that you don't need Part B, and that's another big mistake that we see. That people don't need that. But as you know, with original Medicare only pays 80% of the bill at the doctor's office or outpatient services, physician services, or other supplies. Part B is very important because it'll pay the 80% of the bill, which could be really big. Without that, you're going to be paying 100% of the bill. Number 4 on our list here is thinking you must meet full retirement age to qualify for Medicare. I'm talking about full retirement age for Social Security. You should enroll in the Medicare Part A and Part B at age 65, or unless you're working and your employer offers group insurance and there are more than 20 employees in your company. But Part B and Part A should enroll in those at age 65. Number 5 here would be failing to enroll in Part D because you don't take medications. We see that all the time. And of course there are penalties for not enrolling in Part D when you're supposed to do that. But we see that a lot where people say, hey, I don't take medications, or I only take one little generic medication, and the copay on that's very inexpensive. I don't need a Part D plan. Well, we're required. While Part D appears to be not mandatory, there are penalties if you don't enroll when you're supposed to. Number 6 would be misunderstanding the enrollment period. And we're talking here more about Medicare Advantage. And there are several different enrollment periods, but we're talking about October 15th through December the 7th, which is the annual enrollment period. We see that people miss that enrollment period, and then they have to stay with the plan that they're with currently, and they may want to change. Number 7 would be picking the wrong Part D plan. This is kind of back to the prescription drugs. You just choose maybe the least expensive drug plan, and it may not cover all of your drugs, or maybe the co-pays are higher. So number 7 would be picking the wrong Part D plan. Number 8 would be being too late to buy a Medigap plan. And here what we mean by that is you're too late to buy a Medicare supplement, also sometimes called a Medigap plan. We have open enrollments and guarantee acceptance periods. So this is a major mistake that we see people that are too late to buy the Medigap. They went past their guaranteed issue period of time. Number 9 would be failing to read your annual notice of change with your coverage. So you'll usually receive those notices of change in September. You don't want to just set those aside and not pay attention to them, because those are where you'll find your changes to your current coverage. Number 10 would be not taking advantage of discounts that are available to you. And discounts, by that we mean spousal discounts or household discounts. The insurance companies vary greatly in how they offer the discounts and how much the discount will be. So there are ways to do that. So if you'd like more information on these 10 mistakes, just call the number that you see there, or let us know that you'd like a copy of it, and then we can get that to you. Plus, we can get, if you'd like to speak with an agent, we have agents all over the United States that would be happy to meet with you or talk with you on the phone and go deeper into these particular points that you may have questions, or really any other question you may have about Medicare, original Medicare, Medicare Part C, Medicare Part D, or even Medicare supplements. So thanks for watching, and we'll see you on the next video. How was that one?
That was good.
How many minutes was that one?